Okay, good afternoon, everyone, and welcome to class this evening again. So we were just having a little discussion um, on components and things we're looking for with respect to the scene. And we're going to continue now looking at here, actually checking the injured or the ill person, right? Assessing this patient. And if we go back to the very first lecture and the first PowerPoint, we we would have gotten the understanding that in terms of managing patients in EMS, we use what we call an assessment-based care model, right? And the simplest terms in first aid is we find it, we fix it. In order to find it, you have to look. And hence, the whole concept of checking the injured or the ill person. That's all there is. Checking the injured or the ill person. Right, so let's see what we're looking at. All right. Checking a person appearing to be unresponsive. Let me just pause the recording here. Okay, right, yes, guys. So thank you for just clarifying that we would have covered this. So we're doing a quick recap now. Checking a person who appears to be unresponsive. Always call out to the person as you approach them, right? Typically the unresponsive person, because they would have lost control over their muscles. They have no control over that. They may slump over a chair, slump over a table, or they may be on the ground. Most of the times they end up on the ground, unless there's a physical object or somebody holding them in a particular position. Okay? Always call out to the person to get a response. Sometimes people or patients may not be unresponsive. They may have what in EMS what we call a decreased level of consciousness. And first, all they need to know they're not unconscious at that point in time. And hence the reason we call out to them to try to get a response. Okay. At this point in time, if you don't get a response, obviously you're going to confirm the unresponsive. This is the point in time where I would suggest you call for help, the ambulance in this case. And the reason I tell you at least wait until you have this little bit, this determination is when you call 811, the dispatcher who's taking this information has on their system, they actually have three screens in front of them when you're calling 811. One screen is where they record all the information. One screen is where the GPS system and the mapping tells them where each unit is located. And the next screen, the third screen, actually allows them to give you instructions on how to provide care for the patient. So once you tell them we have an unresponsive patient, naturally they would now hit unresponsive patient and follow the algorithm to guide you into managing this patient until the ambulance gets there. So you're not trying to perform anything by guesswork anymore. And these things are so important to help ensure the patient receives appropriate care. Okay? If it's you alone, obviously, put on your phone, put it on loudspeaker, call for help, and follow the instructions that the dispatcher is giving you. So let's let me ask you this question. If the dispatcher, while telling you to turn the person in a particular position and you didn't hear the entire statement clearly, what would you do? Somebody tell me if you didn't hear the statement clearly, what would you? I mean, this sounds really simple, but I mean, I'm telling you, in emergency situations, all sort of things happen. So what you're gonna do if you didn't hear the instructions clearly? Somebody tell me.
Ask them to repeat.
Ask them to repeat. It's as simple as that. Okay? Don't try to guess and figure out what they were saying. Ask them to repeat. Now, instructions are supposed to be given very clearly, and sometimes with the cellular network, we may have little glitches and little drop in signal strength and those things. Hmm. Excuse me. Hence the reason that the information or the instruction may not have come across clearly. But once you're getting an instruction, make sure you understand clearly. And if the manner in which the dispatcher tells you, it's difficult for you to understand, you ask them, "Can you repeat it? Can you explain a little clearer for me?" Or I'm not sure what you mean. The dispatcher will not get angry with you. They will not curse you. They are there to help you. You are requesting help. Think about it. No person who is healthy and in a state of excellent well-being and those things is going to call the ambulance for themselves. Unless it's one of those prank calls, and there are things in place now to manage prank calls. But generally, when somebody's calling the ambulance, they need help. So we understand that. Okay, good. So call out to the patient, tap them on the shoulder, try to elicit a response. Nowhere here did we say anything about cuffing the person, kicking the person, or as you would see in some of those TV shows, throwing a bucket of water on them. No, we're not doing that. Okay? And this is part of checking there for consciousness. Check for breathing. Look for rise and fall of the chest. Okay? Very, very simple. This is one of the easiest things to do. For breathing, look for rise and fall of the chest. Okay? If the breathing normally is in a regular pattern, up, down, up, down, up, down, and you do not suspect a spinal injury, well, then we could turn them on the side. We don't want to attempt to do anything else with the unconscious person. Okay? When we're dealing with the airway and breathing. Once the airway is clear and they're breathing, great. We don't need to do anything else to manage and maintain the airway. Okay? The reason we ask about scene safety and manage and getting all the necessary information, sometimes the patient may have suffered a fall. And depending on where they fell from and the height and how they landed, which part of the body hit and all those things, there might be the possibility of a spinal injury. And with a spinal injury, we do not want to put the person in the position you see on the screen here, on this little picture. This is called a recovery position, by the way. Okay? And the reason we turn unconscious patients in this position is it allows the person to fall, it allows the tongue to fall on the side of the mouth, thereby allowing the airway to remain clear or patent. If the person is lying on his back or her back and the person goes unconscious, the tongue drops back and obstructs the airway, just as in the case of somebody who's choking. So I want to stop the share here for a sec, right? And we continue with the discussion, but I'm actually going to look for a image of that to show you what I'm talking about in terms of the airway being obstructed. Okay, so I'll pull an image from the emergency medical responder program to show you what I'm talking about. Right. So I think I got it here. Right. I just stretched the image a little bit to make it easier to see, right? Okay, so let me know once it pops up on the screen, please. You guys seeing it? Hello?
Yes.
All right, guys. So, guys, you need to let me know once you start to see the image on the screen, so because sometimes it may take a little bit, right? So on your screen here shows you when we're looking at the your airway. The image on your right shows the open airway and this passageway, right? So yeah, passage at the back of the throat going down into the trachea or the windpipe is clear. The tongue is elevated in its normal position. There is enough passageway here. The airway is, as we say, patent. Okay, so we don't need to do anything to maintain the person's area to protect it. With an unconscious person, this happens. Let me see if I could just get it here. Right. With an unconscious person, this happens. The tongue drops back because of gravity and occludes the airway or blocks the airway. So on the right, you see an open or patent airway. On the left, it's an obstructed or blocked airway. And usually the tongue is the number one obstruction of the airway in an unconscious person. So that is why you want to check for breathing. The person has a patent or a clear airway and the person is breathing great. When we turn the person on the side now in the recovery position, this tongue falls. So what I want you to do, I'll just stop the share with this image here. What I want you to do is take your tongue and just pass it on the your left cheek on the inside there. Just pass your tongue there, the left cheek. Now, the reason I ask you to do that, when we turn somebody on the left side, the tongue falls in that direction. When that happens, it allows the airway to remain patent or to remain clear. And a clear airway is 100% to the benefit of the patient because this allows, if the patient is breathing, you allow a clear pathway for air entry and exit. It gets into the lungs, gas exchange could take place, and the air that needs to be exhaled can be exhaled. Okay? If the person is not breathing, well, we want to start CPR, call for the ambulance and start CPR. Excuse me. And we'll do look at the CPR practical at another class. Circulation, checking for severe bleeding. Look for flowing or spurting blood. If found, control immediately. Okay? So it makes no sense for the patient. It's not beneficial. I should use a better term than that. It is not beneficial for the patient where you assess the airway, you make sure the airway is clear, you check for breathing, so you look for rise and fall of the chest. Yes, the person is breathing, and you don't check circulation. Now, for first aid, um, it is no longer necessary for us to check our pulse in basic first aid. But here's where there's a little bit difference of a difference in the curriculum where COSTAT has put in the program outline for you guys to be familiar with being able to check a pulse. Okay? That makes it easier for your assessment of a patient. In circulation, part of it is looking for severe bleeding. I mean, talking about bleeding that's spurting or flowing heavily, the clothing may be soaked up now. A little word of advice. If you see somebody on the ground and you have blood around them or coming from the clothing, you see it on the ground, what we normally advise you to do is double your estimate of the amount of blood that's lost. Because if the person is wearing clothing, blood has to soak through the clothing before it gets to the ground, wherever it accumulates. So let's use workers in the industries where you wear coveralls. Typically, the average worker would wear, obviously, everybody wears undergarments. There might be a short pants and a t-shirt, and then there'll be the coverall. So a patient on the ground wearing a coverall and blood is pooled around this person. The bleeding doesn't just miraculously bypass all that set of clothing. It has to soak through the clothing, then get to the ground. So you're gonna have some still on the clothing there. So that's why we use an estimate and as a guide to double the amount of blood because obviously it's more than what you see on the ground there. Okay? You want to look for any medical ID tags that will guide us if the person is allergic to anything, if they have any specific medical condition. You should have called the ambulance. The ambulance should be on its way. And obviously now in this position, you may be able to do additional measures. If there's severe bleeding, you want to attempt to control it. Okay. For the responsive person, we start again. As we approach, we call out to the person. Identify yourself, ask them if they're okay, make sure you get permission to provide care, permission to treat them. Okay. On the screen here, you see ask where they are now, current day, date, maybe some basic information. And the typical guideline we use is day, place, time, event, all those things, right? For EMTs. For first aiders, let's keep it simple. Ask them if they know where they are, they know what day today is, those things. It tells you that the person is not just conscious, but they're alert. If they're unable to answer those questions, okay, and we're not looking for exact time. You know where you are? Yeah, home. Okay. Home is where? Uh, Home is home. What street you live? Person can't remember the name of the street. Okay. You have an idea what time it is? No? Hmm. Not sure, but give an average. Morning, afternoon, lunchtime, evening. Can't figure it out. There's an issue with the mental status. So these things are what you would want to take a note of. Obviously, quickly check for difficulty breathing. One of the easiest things to do for the conscious person when they're checking breathing, you ask them, are you having any difficulty breathing? Okay. And of course, you do the same thing. You check the entire body for any major bleed. We're not talking about these small scrapes and bruises here. We're talking about the major bleed where an artery or a vein has been ruptured or it's a large laceration and is bleeding heavily or profusely. These are the things that we're looking at that can be life-threatening. Okay? Same thing, we look for the medical tag. We should have called the ambulance, have the ambulance on the way. Okay? At this point in time, if there isn't anything critical that requires immediate stabilization, such as severe bleeding and those things, we can attempt to gain more information, okay, by using this mnemonic sample. Okay, so did I give you guys the first aid guide app from National Safety Council? Did I tell you guys about that to download?
Yes, sir.
Right. Did you guys get it? Anybody try to download it?
Yes, so we got it on our phones. I did immediately after.
Okay. Anybody didn't get it or anybody didn't try?
I didn't get it.
You didn't get it? You tried to get it and you were not successful?
I ain't get it either. And you said it was Sunday, but I didn't see it.
Right. So I sent a picture of what it looks like. I cannot send you the app. I sent a picture of what it looks like on the WhatsApp group, right? NSC First Aid Reference Guide. I'm actually looking at it on the WhatsApp group here now, right? So you guys could just go back to that and you'll see what it looks like. I know for the Android phones, right? So somebody would have put it on the for Apple. So thank you very much, Tanya. So it's there and you can get it on the Play Store as well for Android. Okay, so please download it. And for those of you who have it, what I would like you to do for me is just open up that app. If you could, if you're using your phone for class, well, I don't know if you'd be able to open the app. If not, then I'd like you to open the app and Just give it a couple seconds open. Okay. And you're gonna see a lot of the different conditions. So I'll use one, I'll go down to unconsciousness, and it has here recovery position, adult or child, and shows you little still pictures. It has the steps to manage the patient, what position to put the patient in. If we look at the one for stroke, it has the fast mnemonic, what questions, what you're looking for. And these things are a big help for us in situations where we have patients. Sometimes, especially if you're not actively involved in patient care, you're gonna forget. If you look at a bee or a wasp sting, it has the first aid steps listed out there. Step one, remove the stinger. Step two, wash the area with soap and water. Step three, put an ice or cold pack on the sting site for up to 20 minutes. And these are the recommended guidelines. So I would really appreciate if there's any possibility, excuse me, if there's any possibility for those who have not gotten the app, if you could go ahead and download and install, please. Okay, this makes your task as or your response, yeah, let me use the correct word. It makes your responsibility as a first aid a whole lot easier to accomplish. Because no longer you're gonna have to fight up to remember if after this semester you don't do anything else in first aid, but this is something that makes it easier for you. What I would suggest you do as well, just as a recommendation, you can share this app with your family as well, family members, colleagues, friends. The more people have pertinent information, the better for a patient. Okay, so now we're back to interviewing an injured or ill person. Now we use the mnemonic sample. Why are we using sample? It gives us pertinent information about the patient and what is going on now. So tell me something. Let me just stop the share here again. Tell me something. Let me use um Tishana. How are you this afternoon? Hello, Tishana? Are you there? Are you hearing me? You guys hear me, right? How come she not hear me? Yeah. Yes, Christian.
Yes, sir.
Right. So somebody give her a gentle nudge offside there, right? Let's go to Victoria. Victoria, you hear me?
Yes, sir.
Right. So let me just go back to this here on sample, right? Victoria, tell me something. Do you know anybody who, when they start to talk, they just ramble and ramble and ramble and ramble? They're given a story, and instead of going from point A to point B, they give you Pythagoras theorem. They give you what else? They give you a whole set of gas laws and all these things and chemical equations and guidelines for a number of things. And then come to the point of their topic. You know somebody like that? I'm not asking you to call anybody name, eh? Simply yes or no would be suffice. So like what I just did there, you know anybody like that?
No.
No, you lucky. You real lucky. Um, Janelle, you know anybody like that? Instead of going from
Yes,
point A to B, they give you the whole dictionary and all
yes,
29 or 30 volumes of the encyclopedia. And yeah, and you're like, Yeah, in your mind, you think get to the point. And worse yet, if you had if you're on a little deadline, and yeah,
Yeah.
right. So thank you very much, Janelle. Now, why am I asking you guys about this? We go back now to the share. The sample mnemonic. The sample mnemonic was created to give us pertinent information about what is going on right now, to avoid the unnecessary description and unnecessary ramblings of people. Okay. So we see here S, symptom, main or chief complaint. It's really in EMS, we say S is for signs or symptom, right? A sign is what you could actually see with the patient. So somebody in class today, tell me what are some of the signs you could see with a patient. Some of the things that would help you indicate something is wrong with a patient. Things that you could see, not you're asking the person, you're approaching the person, you're looking at them, and things that you can see clearly with your two eyes. Tell me.
Pale color skin.
Thompson asking for Brett.
Just now, somebody was saying something first. Let me hear who was the first person.
Pale color skin.
Pale color skin, okay. Right. Who's next? Something about breath?
Thompson gasping for Brett.
Gasping for breath. Good, excellent. So difference in skin color. Person gasping for breath. What else? Somebody else.
Sweating profusely.
Profuse sweating. I like that. Good. What
The
else?
fear-stricken look on your face.
Good. So a look of panic and fear on the face. Good. Right. What else?
The bleeding.
Ah, thank you. Who said that?
Me.
Who is me?
Janelle.
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 Janelle,
Yeah.
you go, you come and you take the rest of the day off. Right, with pay. Right? Tell your employer, I tell you, take the rest of the week off with pay. Right?
All right.
Very good. I
Yeah.
don't know if you'll be successful, but you could tell them that. Right?
All right.
So I just joking. But anyway, that's right. So all these are excellent answers, excellent responses. Definitely if you see bleeding, it tells you something is wrong. And these are things we're looking at. Those are signs. But anybody know what a symptom is? Don't give me examples of a symptom. A description of what a symptom is. Tell me. Anybody? Stop the share again. Right. So while you're thinking about that, just raise your hands here for me. How many of you here are employed? You have a job, whether it's part-time, full-time, and yes, you're studying, and I applaud you for taking steps to improve and personal growth. To Tanya, Aaron, good. Anybody else employed? Jaden, Khadija, that's it. Amina, Vincent, right? Oh no, she's on a Saturday. Good. So a lot of you. Good. Thank you. Thank you very much, guys. Nice. You could lower your hands. Right. Good. So as soon as I remember what the question is about with respect to your employment and those things, I'll ask it. Right. But in the interim, let's go back to right. Somebody had a question. Visual discomfort on the face. Yes, that's right. Thank you for that, Anjali. Thank you very much for that. So let's go back to symptom. Right. So we're looking at a symptom, right? And I don't want an example of a symptom. Right. Coming now to those persons who are employed. I see it just hit me when I came back up to the PowerPoint. For those of you who are employed, right? I wonder if I should make that statement. Yeah, that's okay. It's nothing harmful. We all are aware of it and those things, right? When you go to the doctor, it doesn't matter when last you went to the doctor. That's your personal business, right? But the last time you went to the doctor, or even the time before that, and we're not talking about the sick leave doctor where you want to get a 2 days or 3 days away from work. We're talking about like in my condition where you're actually physically ill, right? You may have the flu or you may have some other condition. You go to the doctor for assistance, right? When you walk into the office and the doctor greets you, does the doctor ever ask you, tell me what's going on with you? Anybody recall the doctor? Or it may not be those exact same words, but something along those lines, to that effect of for the doctor to understand how you're feeling. Stop in the share again. Anybody? Yeah, those of you who are employed. Let me see. Right. So
Yes.
Jamal said yes. Anybody else?
Yes, sir.
Mm-hmm. Mm-hmm. Yep. Yes, Priyanka. Yep. I'm correct. We've all experienced that, right? Now, just a little digressing a bit, right? There was this doctor. So when I worked Carney Limited, I worked as a senior lab. What was the title? Yeah, I think yeah, senior lab technician or something like that, if I remember correctly. And at Carney Distillery, to be able to see the doctor, Carney provided pharmaceuticals and physician services and all these things. So at the distillery, the doctor would be there on certain days, right? And if you needed to see the doctor, you actually paid $5. I mean, even this was in the 1990s, early 2000s. Yeah. Actually 1990s. Yeah. $5 was still, I mean, that's neither here nor there, right? You would go to the timekeeper with a note from your supervisor or your head of department that you wanted to visit the doctor. And the timekeeper would actually write out a card and give it to you to go to the doctor. The doctor would, upon completion of your visit, the doctor would sign it and you'd bring it back. This was their way of ensuring that yes, you were seen by the doctor, and only then would the information be put into the system, and with your next salary, the $5 would be deducted from your pay. Nothing else, just the $5. Medications, the doctor, when you write the prescription, you would go right there, the pharmacy, or the dispensary, as they call it, is right next to the doctor's office. And so I'm doing the rambling thing, but that's okay. You would give your prescription, they would give you whatever is there, and anything that's not there, you're going to buy it outside. But your medication is free too. Right. So enough of the rambling. Right. Where was I before the rambling? Somebody tell me. Let me see who paying attention.
What is a symptom?
Mm-hmm. Right. So the doctor now, this particular doctor, when you walk into his office, and I remember I asked you guys how many of you the doctor asked you, so tell me what's going on with you. There's a reason the doctor is asking that, and we'll get there shortly. This is the road story here, right? This particular doctor, as you open the door and you walk into his office, he would start to write without asking you a question, without looking at you. I mean, his head down, and he just writing, right? Supplements, painkillers, muscle rub, all these things. And I don't, well, in my opinion, I was wrong, but I think with the number of situations and these people he's been seeing over the last how many years, it has been the same thing over and over. We do not want to get into that because it means you're just taking every situation, you're generalizing every situation. Right. So I don't know if the doctor is still alive today because that was like in the late 90s, right? But and he was already an old guy, probably in his 60s at that point in time. Why does the doctor ask you, tell me how you're feeling or how are you today? It's in an effort to understand what symptoms you are experiencing. So think about a 70-plus-year-old person who is unable to read and write, would have worked their entire lives, whether it is in a cane field, whether it is in a market, whether it is doing some um, domestic work or whatever it is, right? Unable to read and write. This person may not understand what the term symptom conveys. So when the doctor asks, tell me what symptom you have, this person may not understand that. So to make it easy, physicians in general will break down the terminology into terms we can understand. So any doctor tell me how you're going today. Tell me how you're feeling. You answer, doc, my head hurting me. Oh, you have a headache. Headache is a symptom. I'm feeling weak. Weakness is a symptom. My tummy hurting. Pain to the stomach. Abdominal pain. I constipated a week now. Constipation, another symptom. So you see what I'm getting at here? Symptoms are how you feel. You cannot see it. It is how the patient feels. Signs you can see, it's outward displays. Symptoms are how the patient feels and they describe it to you. You ask. That's the only way. You'll figure out what symptoms the person has. And this is what the doctor does. And that's why they ask you these questions. Okay? So S, instead of just signs, we look at signs and symptoms. A, allergies. Are you allergic to anything? M, are you on any medication? Medication could be as simple thing as supplements, vitamins, any supplement you're taking. If you're going by, this guy still around people? Trevor Sayers. You all know who
Yeah,
Trevor is?
yes,
Yeah.
he alone. He not talking plenty again.
Serious? What happened to Trevor Sayers? The last thing I saw about Trevor Sayers, he was somebody spray um his Bop or Protox or something like that. The spray is he the spray he I think it was a spray in his eye or something like that. Something nonsense he was on. But Trevor Sears back in the day had in Port of Spain and I was working ages, he had this herbal store, naturalized herbs or something like that. And the amount of people was there who would be there um buying stuff, right? Even if you're taking some herbal medication, it's important to know. Okay? P, pertinent past medical history. Do you suffer with any medical condition? We have the general ones, the asthma, diabetes, high blood pressure, but also any medical condition, okay? Anything you've been diagnosed with. What was what was your last food or drink? When last you had something to eat or drink? So think about it. The person mixing concrete to cast a floor, right? You're mixing concrete. It is 2 o'clock in the afternoon. This person mixing concrete, this team of individuals mixing concrete since 6 o'clock in the morning. It's a large area. And this person who feeling dizzy, the last time he had something to eat or drink was lunchtime the day before. You don't think you're gonna get out of feel weak and dizzy? Your body burning fuel needs the energy, so it's gonna use up its glucose reserves. It's gonna start to tap into the fat reserves. Eventually, once those things deplete, you start to feel to get the weakness and the dizziness and those things. So that's why it's important to get this information. E, events leading up to the illness range. What was the person doing leading up to this condition? Sample gives us pertinent information, critical information now, so we can have a nice understanding what is going on. Now, when the EMT arrives with the ambulance, they will ask questions along the lines of sample here, but they may ask a lot more. That's okay. When you get to the patient in the hospital, the nurse or the doctor may ask the same thing and, a lot, and additional questions. Why? It is not to belittle you or to show that, hey, I know what I'm doing, you do not know what you're doing. No. It is in an effort to understand what is the patient's current status. It might change based on some of the things you may have done for the patient that may have benefited the patient. So it's in an effort to see if the patient has improved, remained the same, or deteriorated a bit. But sample here, the purpose of sample is to help us interview the person or assess the patient and get pertinent information now. Okay? Any questions on that? Of course, when we're doing an assessment of the patient, we do a physical head-to-toe check. Start at the head, check the face, check the neck, the shoulders, the chest. We'll do a visual inspection of the tummy. We check the hips, each leg, and then we check each arm, and then we check the back. You're physically touching the person. You're feeling, right? And these are the things you're looking for. Dots, deformity, open wound, tenderness, and swelling. So I hope now it's starting to impress upon you the importance of having that little app. Because realistically, I mean, I've been teaching these programs for almost 2 decades, right? Maybe 2 decades if I go back and check the records from the first class I ever taught. And after I teach a first aid class, I can guarantee you 6 months down the road, if I ask somebody to tell me what dots is, they forget. But if I ask the person how to check somebody from head to toe, they start, well, you squeeze the head, you feel the neck, you squeeze the chest, the shoulders. They could explain it, but tell them to describe what dots is. They're unable to. The app now it's supposed to have dots on it to guide you, to help you understand. Okay? And the importance of it is whatever information we can get very quickly, pertinent information, makes it easier for us to manage our patient. Okay? So these are some of the things we're looking for when we talk about deformities. Dots. A, a deformity here. B, open wound. T, tenderness, pain in the area you touch. S, swelling. With swelling, obviously, you want to compare both limbs, right? Okay? And this is the sequence here for the head to toe check. Obviously, you start at the head, go down to the shoulders, the chest and abdomen, the hips, the legs and feet, the arm and the hands. And that's it. If during the assessment of any one of these you find a problem that is immediately dangerous to life, and the number one thing here would be severe bleeding, you stop your assessment, control it, and once it's controlled, then you resume. If you're unable to control it, you cannot continue your assessment. You have to keep focusing on trying to control that. All life-threatening conditions must be dealt with first before you could go to all the others. Okay? I think that is it for that chapter. Any questions? No questions? Just pause the recording here, right? Okay, guys. So, as I was indicating, we're going to look at some medical emergencies, some of the conditions, and typically with these videos I'm going to show, it gives you some background information to help you understand why the person is in this particular situation, and then we look at how can we manage it. Now, some of the treatment may be beyond the level of first aid, but that's okay. It's just the videos guiding you and showing you how the person gets treatment to get better. At the end of the videos, we will look at what we do as a first aider, right? So with the Zoom platform here, I just need to open the video and pause it, and then I'll share it. Otherwise, you wouldn't be able to see it. Okay, so let me just pause the recording and I'll get the videos up. And this time, please, as soon as the video pops up on your screen, let me know. So I'll be able to hit play. Okay, so the first one we're going to look at is asthma. I'm going to try to understand how asthma affects our body, what it is about, and how can we treat. All right, so let me get it here. Right, so you should be seeing it up on your screen now.
It starts with a cough or a wheeze. Soon, your chest feels tight. Your breathing speeds up and gets shallower, making you feel short of breath. These are common symptoms of an asthma attack. Around the world, more than 300 million people suffer from asthma, and around 250,000 people die from it each year. But why do people get asthma, and how can this disease be deadly? Asthma affects the respiratory system, particularly the smaller airways, such as the bronchi and bronchioles. These airways have an inner lining called the mucosa that's surrounded by a layer of smooth muscle. In people with asthma, the airways are chronically inflamed, which can make them hyperresponsive to certain triggers. Some of the many asthma triggers include tobacco smoke, pollen, dust, fragrances, exercise, cold weather, stress, and even the common cold. When people with asthma are exposed to these triggers, an asthma attack or exacerbation can occur. But how exactly do such everyday factors lead to an asthma attack? If an asthmatic is exposed to a trigger, the smooth rings of muscle that circle the small airways in their lungs contract and become narrow. Simultaneously, the trigger worsens inflammation, causing the mucosal lining to become more swollen and secrete more mucus. Under normal conditions, the body uses this mucus to trap and clear particles, like pollen or dust. But during an asthma attack, it blocks the narrowed airways, making it even harder to breathe. These effects lead to the symptoms of asthma. Smooth muscle constriction results in the feeling of chest tightness. Excess mucus and increased inflammation can cause coughing, and the wheezing noise? That happens because as the airways constrict, air whistles as it passes through the narrowed space. These symptoms may make a person feel like they're running out of air. Yet counterintuitively, during an asthma attack, the inflammation can make it harder to exhale than inhale. Over time, this leads to an excess of air in the lungs, a phenomenon known as hyperinflation. The trapping of air inside the lungs forces the body to work harder to move air in and out of them. Over time, this can lead to reduced oxygen delivery to the body's organs and tissues. Sometimes, in untreated severe asthma attacks, the body can't keep up, which can lead to death from lack of oxygen. So how do we prevent these uncomfortable and potentially fatal attacks in people who have asthma? One way is to reduce the presence of triggers. Unfortunately, the world is an unpredictable place, and exposure to triggers can't always be controlled. This is where inhalers, the primary treatment for asthma, come in. These medications help asthmatics both control and prevent their asthma symptoms. Inhalers transport medication along the affected airways, using a liquid mist or fine powder to treat the problem at its source. They come in two forms. There are reliever medications, which treat symptoms immediately and contain beta agonists. Beta agonists relax constricted muscles, allowing the airways to widen so more air can travel into and out of the lungs. The other form of inhalers serve as preventive medications, which treat asthma symptoms over the long term and contain corticosteroids. Corticosteroids reduce airway sensitivity and inflammation, so asthma can be kept under control. They're also crucial in preventing long-term damage from chronic inflammation, which can cause scarring of the airways. Inhalers are known to be very effective and have helped many people live better lives. Although we've come a long way in improving how we treat and diagnose asthma, we still don't know its exact causes. We currently believe that a combination of genetic and environmental factors play a role, potentially acting during early childhood. Recent research has even linked poverty to asthma incidence. This may be due to reasons ranging from exposure to additional pollutants and environmental irritants to difficulties in obtaining medical care or treatment. As our understanding of asthma improves, we can continue to find better ways to keep people's airways happy and healthy.
Okay, so that's asthma, how asthma works, how it affects our bodies. And let me get your questions. Nobody has any questions? Everybody okay with that?
So it was a good video they did, but they didn't talk about prednisolone.
Prednisolone? Right. So
Yeah.
prednisolone is a steroid, right? Am I correct?
Yes, sir. It's
Right,
also you.
right. So typically, when we look at those things, in the acute stages, which is what we would be dealing with, or maybe call upon to manage a patient in pre-hospital care, what we would look at is the reliever medication, which you would see people having the Ventolin puffer, or if it's the generic ones, you may see it as the Astelin or Salbutis or whatever the name is, where the active ingredient would be the salbutamol, and its effect is to relax the muscles, right? The prednisolone, where typically would be the medication a physician would prescribe for treatment over a period of time to reduce the sensitivity of the airway, to actually help the person breathe better over a period of time. Now, prednisolone is one of them, right? You have a whole set of different medications that are used nowadays, different types of steroids that are used, right? That's just one of them. But typically, when we look at EMS and emergency care outside of the hospital, the salbutamol puffer, which is the reliever, is the medication, the go-to medication. Even if we're not using the puffer in an ambulance and they're giving you, they're nebulizing you, we would be using the Ventolin ampules, or they might actually mix the Ventolin with with the saline and nebulize you. Okay, so typically outside of the hospital, we wouldn't be looking at the prednisolone. Okay, and even with this medication here, it is the patient. Let me get this clear with you guys, right? Even though we're going through what is needed for the patient, excuse me, right? What is needed for the patient, we still are not authorized at the first aid level to administer medication. Okay. The program curriculum does not cover indications, contraindications, dosage, and all these things when dealing with medication. So typically, if it's somebody who is asthmatic and they need a puffer, you could get the puffer for them. You can shake it to agitate it. You could take the cap off. You could put it in their hand. They need to administer it themselves. Okay, let me make that clear. As first aiders, you are not authorized to administer the medication to the person. Okay, they need to take it themselves at home. Now, when you look at the Medical Board Act, it is very clear. It does not affect what you do at home with your relatives and so forth, right? But in terms of the workplace, um, no, you cannot administer medication to anybody. Okay, all right. So let me hit you guys a question. What are some of the signs and symptoms the person experiencing an asthma attack may may experience or may display? Anybody?
For breath?
Say again? All I heard is breath.
Difficulty breathing.
Okay, I was still speaking with Priyanka there, right? Because I know she made the first comment. All right, guys, so let's be a little courteous. Let's hear her.
Oh no, I said wheezing for breath.
Wheezing. Okay. Yes, Omadara, you were saying? Omadara, Miss Thompson, what are you guys saying now? Everybody gets silent. So yes, definitely wheezing. Anything else you want to add to that? What you saw on the clip there, on the video?
Coughing.
Coughing, okay. What else? Anybody else?
Shortness of breath.
Shortness of breath. What else? There's a
Tight.
yes, thank you very much. Tightness of tightness in the chest. And I've been asthmatic my entire life. Thankfully, it's been over, let me see, probably about 25, closer to maybe about 20, between 25 and 30 years. I haven't had a full-blown asthma attack, right? I wheeze every so often. This recent flu that I got, this respiratory illness, triggered the wheezing and definitely the tightness in the chest. You, wow. So let's do a little exercise here, right? I want everybody to unmute your mics. Unmute your mics and we're gonna have a conversation, right? I want you, anybody here asthmatic other than me? Nobody? All right, good. So unmute your mics, come on. Now, really and truly, I'm supposed to have you unmute your mics and your camera is supposed to be on, right? That's the instructions. That's the instructions I got. And
And my background is very noisy because I traveling, but
all right. So if you're traveling, you could mute your mic. All right. So here's what we're gonna do, right? I want you to take a deep breath in, out. Let's go again. In, out, right. So you're gonna listen to me now. This is what you're gonna do. Take a deep breath in, out, stop. Hold it in. Continue now. You're breathing in now. You're not exhaling. You're breathing in, out, stop. In, out, stop. Right. Exhale now. Tell me, with those three breaths where I stopped you from fully exhaling, what were you feeling with each additional breath? Tell me.
Chest started to get tight.
Chest starts to get tight. Anybody else?
and breathe.
Cannot breathe, right? Anybody else?
Felt like you're suffocating.
Felt as though you're suffocating. Thank you very much, guys. So you could go ahead and mute back your mics, right? Now, what you guys experienced there is probably 0.1% of what an asthmatic patient would experience during an attack. And I dare say it might even be 0.01%. It comes on very quickly. The muscles constrict, locks up the airway. All right. And the medication is literally a lifesaver. That medication relaxes the muscles. Excuse, and as the muscles relax, the airway regains its regular size. And as we saw in the clip there, it's not so much about being able to inhale because you could still inhale, but because the airway is narrowed, less air gets exhaled each time. So what ends up happening, you have what, if I may use the term dead, you have dead air accumulating in the lungs because the oxygen has been absorbed by the body and that air is of no value to the lungs. So it's just taking up space there. And each time is less and less air getting into the lungs. Okay? Less and less oxygen getting into the lungs for absorption by the body. We need to help this person. And asthma can be fatal. Okay, so we saw the clip there with the recommendation to use the puffer. If the person does not have a puffer, or while so let's go back to the scenario where the person in the office and is having difficulty breathing. Tell me, what are some of the things you'd want to find out from the person? Using the sample acronym there. So let me just get the sample back up and running. The sample acronym.
The symptoms,
Right? So you'd want to find out what signs and symptoms the person is having. Okay? So what we ask them to tell us?
How's it feeling? What's happening?
Good. Describe to me how you're feeling. Tell me what's going on. Obviously, one of the things we want to ask them is, are you having any difficulty breathing? Okay? So you're using the asthma or the difficulty breathing scenario. S, signs and symptoms. You look at the person for any outward displays. Things like gasping, clutching the chest, those things, right? Panic-stricken appearance. Symptom, are you having any difficulty breathing? Yes. Tell me, are you any other feelings, any other problems? What else? Tightness in the chest. Now, what can we do for this person? Typically, pre-hospital care starts with putting the person to rest. So if the person was working, whatever it is they're doing, we need to stop the person from whatever it is they're doing, put them to sit down. Okay? Let them relax. All patients, you want to loosen tight clothing. So you may just want to unbutton the shirt. Okay? Obviously, a major concern here is maintaining the patient's privacy. So if it is, you could get the person to an area that is away from everybody, or if you could move everybody away from the patient, because typically people may want to crowd around, and what you want to avoid is somebody taking the cell phone and recording the patient. So you have to be mindful and respectful for the patient's privacy. Now, this brings us into the other is situation where some patients may some patients may want a female first aider to provide care for them, mainly because might be personal belief or religious beliefs. We have to respect that. However, if the situation does not permit, if there is no other first aider, but you have a female colleague, you could ask the female colleague if they're willing to help you, and if the patient is willing to, and simple thing as unbuttoning the shirt. The female patient may not want a male patient to do that. Or if the patient could do it themselves, great. If not, then you may want to get up. And guys, are just being realistic here because these are situations that we have encountered over the years. So I bring it to your attention so you can be prepared for situations like that. So S, signs and symptoms. A, are you allergic to anything? Okay. What we asking next?
Any medication?
That's right. Are you on any medication? M. Now, another pertinent past medical history. Typically, the easiest thing to ask is, do you suffer with any medical conditions? Okay. And sometimes we ask you, well, what do you mean? And you use examples, things like asthma, diabetes, high blood pressure, those sort of things. Do you suffer with any condition at all? Because sometimes it may require us to just be a little more specific with the patient and obviously find out the last food and drink and what the person was doing leading up to this. If the person is asthmatic and let's say they were cleaning the house and they got exposed to a lot of dust, or there's a bushfire close by and the smoking inhalation may have triggered an asthma attack. Let's say in the office, the person was having a conversation with somebody and it deteriorated into a disagreement of opinions that may have resulted in a heated conversation. And this may have triggered an asthma attack. These things happen. Okay, so it's important to get the history, to get all this information. As a first aider, remember, have the person stop what they're doing, let them rest, sit down. You cannot put a conscious person with difficulty breathing to lie down. It makes the tightness on the chest worse. So if you ever had the flu, and let me just come back to you guys here, right? Anybody here ever had the flu, and when you lie down to sleep at night, you feel as though you're suffocating or you're stifling, and you have to sit up or you have to adjust yourself to sleep better. Has that ever happened to anybody?
Yes, sir.
One person. Anybody else?
Yes, sir.
Yeah. So I'm sure we all would have experienced that at some point in time. If you're shy and you don't want to say so, not a problem. But think about that situation, and I want you to think about that. And this is what somebody who's having difficulty breathing will experience when you put the person to lie down. Hence the reason we try to put them to sit down. Okay? Calming the person down is a major thing. Very, very important. Okay? Lowering that heart rate. And the faster the heart beats, the more oxygen is pumped through the body, the more oxygen is used up. Slow down the heart rate. Get the person to calm down. Lower the demand for oxygen. Because with a narrowed area, the supply is affected. Okay? If the person has a puffer, great. If they don't have a puffer, what can we do? So what I'd like for you guys, for somebody to do for me, is look up. I want you to look up this condition, this technique, pursed lip breathing. So let me just put it on the chat here. Right, right. Look up pursed lip breathing. Right, so you want to look up pursed lip breathing techniques. It's something that is suggested for persons who may be having difficulty breathing and you don't have an oxygen supply available, well, a supplemental oxygen supply, or you don't have a puffer available for the acute stages to help you. Okay, so you guys could look up that, see if you could get any videos on those things, right? Um, Again, it is a recommendation for pre-hospital care. In hospital, it's a lot easier because you would have countless areas with supplemental oxygen ports available. You have you have the medications available and those things, right? It's easier to manage. But outside of the hospital, with all those things available, we have to improvise, we have to manage these patients. Okay? All right. Any questions on that? I'm asking you because I want to move on. No questions? Everybody okay? All right, so let's look at let me just get the next video up and running. In the meantime, I'll ask you guys to let me know or think about any other questions you may have. Okay, just get it to open here. Right. Coming back to you guys now. So tell me, what do you know about a heart attack? What is a heart attack? Anybody? And don't tell me attack of the heart. What?
Something that happens when the heart is blocked.
Something that happens when?
The blood that goes to the heart is blocked.
Okay, blood flow is blocked. Anybody else?
the sudden tightening of the heart muscles.
Sudden tightening of the heart muscles. Okay. Anybody else?
Yeah.
Nobody else? All right. So let me share the video here, and we'll look at it and we'll discuss it afterwards. Right? Because it's a really nice video. It gives you pertinent information.
Every 2 seconds, someone somewhere in the world experiences a stroke. And 1 out of every 6 people will have one at some point in their lives. Strokes deprive brain cells of oxygen and are one of the most common causes of death and a leading cause of preventable disability. When someone experiences a stroke, quick medical care is critical and can often help avoid permanent brain damage. But what causes strokes in the first place, and what can doctors do to treat them? The brain makes up just 2% of your body's mass, but consumes more than 20% of the oxygen in your blood. That oxygen is carried to the brain through a system of arteries. Carotid arteries supply the front of the brain, and vertebral arteries supply the back. These are connected to each other and divide into smaller and smaller vessels that get billions of neurons the oxygen they need. If the blood flow is interrupted, oxygen delivery stops and brain cells die. There are 2 ways this can happen. Hemorrhagic strokes are when a perforated vessel allows blood to leak out. But the more common type is the ischemic stroke.
Oh, I got the wrong one playing there. Sorry about that. I had the wrong one. Let me just get it back to the. Oh yeah, yeah, right. All right, so I see it here. Yeah, let me get the correct one up and running. And nobody tell me that I'm playing the wrong video. Oh, shucks. Right, so I have this is supposed to be the correct one. Right.
Approximately 7 million people around the world die from heart attacks every year. And cardiovascular disease, which causes heart attacks and other problems like strokes, is the world's leading killer. So what causes a heart attack? Like all muscles, the heart needs oxygen, and during a heart attack, it can't get enough. Fatty deposits, or plaques, develop on the walls of our coronary arteries. Those are the vessels that supply oxygenated blood to the heart. These plaques grow as we age, sometimes getting chunky, hardened, or inflamed. Eventually, the plaques can turn into blockages. If one of the plaques ruptures or cracks, a blood clot will form around it in minutes, and a partially closed artery can become completely blocked. Blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes. This is a myocardial infarction, or heart attack. Things can rapidly deteriorate in the absence of treatment. The injured muscle may not be able to pump blood as well, and its rhythm might be thrown off. In the worst-case scenario, a heart attack can cause sudden death. And how do you know that someone is having a heart attack? The most common symptom is chest pain caused by the oxygen-deprived heart muscle. Patients describe it as crushing or vice-like. It can radiate to the left arm, jaw, back, or abdomen. But it's not always as sudden and dramatic as it is in the movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and the elderly. For them, weakness and tiredness may be the main signal. And surprisingly, in many people, especially those with diabetes, which affects the nerves that carry pain, a heart attack may be silent. If you think that someone might be having a heart attack, the most important thing is to respond quickly. If you have access to emergency medical services, call them. They're the fastest way to get to a hospital. Taking aspirin, which thins the blood, and nitroglycerin, which opens up the artery, can help keep the heart attack from getting worse. In the emergency room, doctors can diagnose a heart attack. They commonly use an electrocardiogram to measure the heart's electrical activity, and a blood test to assess heart muscle damage. The patient is then taken to a high-tech cardiac suite, where tests are done to locate the blockages. Cardiologists can reopen the blocked artery by inflating it with a balloon in a procedure called an angioplasty. Frequently, they also insert a metal or polymer stent that will hold the artery open. More extensive blockages might require coronary artery bypass surgery. Using a piece of vein or artery from another part of the body, heart surgeons can reroute blood flow around the blockage. These procedures reestablish circulation to the cardiac muscle, restoring heart function. Heart attack treatment is advancing, but prevention is vital. Genetics and lifestyle factors both affect your risk, and the good news is that you can change your lifestyle. Exercise, a healthy diet, and weight loss all lower the risk of heart attacks, whether you've had one before or not. Doctors recommend exercising a few times a week, doing both aerobic activity and strength training. A heart-healthy diet is low in sugar and saturated fats, which are both linked to heart disease. So what should you eat? Lots of fiber from vegetables, chicken and fish instead of red meat, whole grains, and nuts like walnuts and almonds all seem to be beneficial. A good diet and exercise plan can also keep your weight in a healthy range, which will lower your heart attack risk as well. And of course, medications can also help prevent heart attacks. Doctors often prescribe low-dose aspirin, for example, particularly for patients who've already had a heart attack and for those known to be at high risk. And drugs that help manage risk factors, like high blood pressure, cholesterol, and diabetes, will make heart attacks less likely too. Heart attacks may be common, but they don't have to be inevitable. A healthy diet, avoiding tobacco use, staying fit, and enjoying plenty of sleep and lots of laughter all go a long way in making sure your body's most important muscle keeps on beating.
All right. So let me just stop the share here. Good. What is a heart attack? Anybody? Tell me.
Also known as myocardial infarction.
Right. Also known as an MI, myocardial infarction. What it is? What is it?
Break of oxygen supply to the myocardium.
Right. And what causes that? Let me hear somebody else.
Clots.
A blockage. It could be a blood clot or it could be something else, but it could be a fatty deposit buildup, right? It could be a blockage. Now, whether it is a complete blockage or a partial blockage depends on what's going on with us. Sometimes, as you saw in the video, there could be the narrowing of the arteries over a period of time based on the buildup of plaque. Now, naturally, as we get older, our arteries, our arteries lose their elasticity. That happens. And typically, you'd see a lot of recommendations in terms of supplements and things you can take to maintain the elasticity of your arteries and stuff, right? But hardening of the arteries is real. And we saw in the clip there, diet, genetics, and a host of other factors play a contributing role to the buildup of plaque. And I'll leave it as plaque on the inner wall of the artery. Okay? So eventually, the amount of blood passing in the blood vessel. Now, this is the blood vessel supplying the heart muscle itself, right? So let me just get and it's a little bit easier to explain for you guys. I mean, even though it's basic explanation I'm doing, you guys have done a lot more in terms of your programs. I'm sure you guys would have done some ANP, and for those of you who doing those programs, right? Let me just get the human yeah, this chapter. So I'm just gonna share a little image. No, not this one here. I just want to pull up a particular PowerPoint with a image, so it's a little bit easier to help explain for you guys. Right. I'm just looking for a particular image here. Right, so I get one. Nice. So let me just share it here. All right, come back to you guys. Share this image here. Right. Good. So just let me know when you see it on your screen, please.
Yes, sir. It's
Good.
there.
So what we're looking at here is a blockage of the one of the vessels supplying the heart. Now, this one here in red, that's the aorta, that's the main artery leaving the heart, right? Carrying blood there, and it's gonna divide and all these nice separations to ensure the entire body gets oxygenated blood. The heart itself receives its supply, as you heard, from the coronary arteries, and these typically branch off from the aorta as we to supply the heart muscle itself. It's like your car, your automobile, your van, your car, your truck, your motorbike, wherever it is. It needs fuel to run. Okay, the fuel comes from the gasoline. In this case, for the heart muscles to work, they need fuel. And the fuel gets there from the blood. The blood brings oxygen and nutrients via these coronary arteries. So if you look at the little inset here, what you see is a blockage. With a blockage over a period of time, the amount of blood being delivered to the heart muscle themselves, at rest, it might be enough. But with increased activity, let's say you decide to go to the gym for the first time, and instead of going to a doctor and getting some advice, or instead of taking it easy for your first day or two or first week or whatever, you decide to go hardcore one time. You jump on a treadmill and you want to try to run 10 miles, or 10 miles is what, 16 kilometers. Yeah. You try to run 16 kilometers at full pace. And 2 minutes in, you get chest pain. More than likely, what happens here, and this is with angina, right? With angina, the amount of blood passing through let me see if I get it here. Go back to, right. With angina, the amount of blood passing through the heart at that point in time is unable to supply the demand. So angina, as we see here, and this is a first responder program, that the EMR program we teach. Angina, also called angina pectoris, is chest pain caused by inadequate flow of blood and oxygen to the heart muscle. Patients may describe it as a pressure or heavy discomfort. And again, signs and symptoms: shortness of breath, sweating, patient appears frightening, the feeling a sense of doom. It has all the signs and symptoms of a heart attack. Okay, but when the person sits down and rests, the heart rate, and that's why I tell you it's so important to have the person stop what they're doing. As they sit down, the heart rate starts to slow down. If it is angina, as the heart rate starts to slow down, the demand starts to drop. And eventually it may reach a point where the amount of blood passing through here is sufficient once more. With a heart attack, the difference here is there's a blockage of the vessel. Angina, there's a narrowing. With a heart attack, there's a blockage there. And the blockage could be a piece of plaque breaks off. And let me see if I get that now. Right. Piece of plaque breaks off, or it may lift and totally occlude the artery. So the area, as you see with the inset here, the area that this vessel is supplying no longer gets any blood. So everywhere beyond the blockage no longer gets any blood, and that is where we have the heart attack taking place. Same signs and symptoms, and it may be more. The difference here now with angina, when the person sits down and rests, the pain may go away as the heart rate drops. With a heart attack, the pain, it's either constant or it keeps coming and going, but it does not go away. That is the heart attack, and that is what we're dealing with outside of the hospital. Okay, so let me just close this. Let me just stop the share now, and let's come back to us in the pre-hospital environment. What can we do to help someone who is experiencing a suspected heart attack? All right, let me just share this part of the PowerPoint for you guys. I believe, just see which one to close off here first. I think we same thing open twice. Right, I think it's supposed to be this one. Right, so these are the questions we would use when we're interviewing the person. Sample is critical here. Very important. This is where you take note of your signs and symptoms, make sure you remember it, and get this information. Because if it is a heart attack and you're able to get all these questions answered, great. Sometimes the patient may deteriorate to the point where you're unable to get any further answers. But what you have gotten here is critical, is crucial for the responding EMTs. Okay, so I'll stop this one. All right, so let me just close that off. All right, and I will share the next one with signs and symptoms and so forth. Good. So on your screen now, you should be seeing what to look for. Okay, chest discomfort, pressure, squeezing, sweating, lightheadedness, dizziness. A very common one you hear people speak about is pain in the left arm. It does not always happen. It happens a lot, but not every single time. Okay, so we're looking at all these signs and symptoms. The patient may not experience every one of them, but they may experience a few of them. The most common ones, the tightness in the chest, the difficulty breathing, numbness or tingling in the arm. It may go down to the left arm or it may go to the back, the jaw. Some people, the pain is so great, they feel as though the tightness on the chest is so great, they may feel as though there's an elephant sitting on the chest. Okay, so what can we do? Okay. So I will post again, these will go up on the e-classroom, so you guys will have access to it, right? So if you notice, what can we do? The very first thing, have the person sit. Okay. Typically, with the knees raised, lean against a stable but comfortable support. It depends on where you are. And okay, what we want to do, and the easiest way you could manage this is have the person sit in what we call the position of comfort. The position of comfort, the person puts themselves in the position where they get the least pain. Okay? And sometimes they may actually feel more comfortable like this, sitting with the knees raised, lean against a stable object such as a wall or something, right? Do not allow the person to walk. Why? Why we don't want to allow the person to walk? Somebody tell me.
You'll be getting the heart rate up again.
Mm-hmm. Exactly. Walking, the simple
Sir,
act of walking.
sorry, I have a
Yeah,
question.
sure.
When I used to do, you said in the past video, past screenshot, you said that with the treadmill, you
Mm-hmm.
said that when the heart rates and people feel like they're gonna pass out, they're supposed to sit down. Correct?
Right. Yeah.
When I used to do track and field, and this we used to almost pass out and so on. They would tell us not to sit down, we have to walk it off and so on. So I
Right.
don't know.
Right. So that is track and field. Here we're dealing with a condition where the heart is damaged. The heart is affected by a blockage. Right. So when we put the person to sit down, we want to reduce the workload of the heart. We want to get this heart rate um, down as quickly as safely as possible. Okay. Continuing to walk or move around, yes, the heart rate is going to slow down, but it's going to take a longer period of time. And the available oxygen to that area of the heart where it's already restricted, you run the risk of causing further issues with the person. So what we want to have the person do, remember, we're not into a sporting activity here. We are looking at getting the heart rate to drop down to let me see, to get it as safely lower as possible for the benefit of the patient. In this case, because there's a blockage, right? We do not want to have increased load on the heart, increased demands on the heart. So, easiest way to reduce the workload and the demand of the heart is to have the person stop what they're doing. Put them to sit down, put them to rest, never put them to lie down, because again, the tightness on the chest will get worse. Okay? And we go back to this here. Do not allow the person to walk. Doing so can put more stress on the heart because it continues, even though you're walking as opposed to running, there's still a significant demand on the heart and there's still an increased workload of the heart. Okay? Your next step now is to keep the person calm. This is easier said than done. Think about now, we go back to asthma and the difficulty breathing, where I ask you guys to take the breath, exhale, take the breath, exhale, and the little feeling of suffocation, right? Again, this magnified 100%. It gives the person a feeling of fear, a feeling of doom that they're gonna die. And people will panic in these situations. So now, if we throw our minds back to the very first class, excuse me, the first and the second classes, where we talk about our rapport with the patient, having a conversation with the patient, okay? Getting the patient to feel comfortable and that level of psychological reassurance with you as the first aid, as the EMT, as the first responder, whatever it is, as the safety warden, you're there. The person, that level of reassurance helps to calm them down a bit. It will never be 100% because we know something is wrong with the person. It's always in the back of their minds. But talking to the person, you can get them to calm down a bit. Make sure the ambulance is on its way. Now, here's where there's a little bit of a difference. So we see call 911, obviously in Trinidad, it'll be call 811. Do not drive the person to a medical facility. Wait for EMS to arrive. One of the things we learned in EMS and in first aid and all these programs we teach, sometimes you may have to make a judgment call. Okay? Ideally, all the programs you look at, the recommendation is to wait for EMS to arrive because on the ambulance you will have trained professionals who will have the necessary tools and equipment to assess their blood pressure, listen to their lungs, do their lung songs, administer oxygen. They may have if it's an asthma attack, they may have Ventolin. If it's a heart attack, they may have nitro and aspirin. And some ambulances now we have paramedics, they may have additional medications. That's all well and good if they get there within a certain time frame, a reasonable time frame. But sometimes, what if you call the ambulance and they tell you the closest ambulance is X location? And when you think about it, and the reason I say X location is because we have colleagues from other Caribbean territories here as well, right? So what I want you to think about for each of us, whether in Trinidad, in Antigua, in Jamaica, in Grenada, wherever you are, think about a location that is an hour away from where you are. Okay? And what if the location where you are, the health facility, the accident and emergency is 10 to 15 minutes away? Sometimes you have to take those things into consideration and decide for yourself what is the best option. So, like me, for example, if I drive slow, it'll take me, so if I drive, let's say 30, let's say I drive 30 kilometers per hour, it will take me between 5 to 10 minutes to get to cover accident and emergency. If I drive at the speed limit, it will take me probably between 3 to 5 minutes. And if I drive like an idiot, which I do not do, it will take me anywhere between 1 to 2 minutes to get to the accident and emergency. So I live very close to the accident and emergency department. And it has served me well because when I had the anaphylactic reaction a couple of years ago, I didn't know I was allergic to a particular antibiotic. And 1 o'clock in the morning, I had to be going to the hospital there with my wife. I made a judgment call. I made a decision there because the ambulance was actually coming from Shogunas, which is about 15 minutes, let's say 15 to 20 minutes from my location. And the accident and emergency is right there. I didn't have a spinal injury. It was an anaphylactic reaction where time is critical. Thankfully, now I have an EpiPen at home just in case of anything. And this is one of the nice things about functioning as a EMT as well, right? I have equipment at home. So what about those who don't? You may have to make a judgment call. I am not telling you to do it. I'm telling you to assess, get the information and look at it, and then you can make a decision. Okay? While waiting for EMS to arrive, loosen tight clothing, get any medication. So we use the SAMPLE acronym to get questions answered. Now, if the patient has their own medication and the patient, excuse me, patient is a cardiac patient. Let's say the patient was diagnosed with angina a couple of years ago and they're on medication. They normally have aspirin and the pill for under the tongue, the GTN. Some people have it as a spray called nitroglycerin. If they have that, you can get access to it, let the patient take their own medication. Okay? Do not put it in their mouth. You could get it, you could open the package, you could put some of whatever the pill it is, the dosage, you could put it in their hands, but they need to administer it themselves. Now this is if you're at work. If you're at home, again, the medical board act says you're exempted at home. At home, you can do that, you can put it in their mouth. But again, remember, you need to know what the dosage is. So if you have parents like, let's say you have parents who may be asthmatic or they may have a cardiac issue or diabetic or whatever it is, be familiar with the dosage of their medications. We clear on that? Any concerns, any queries and so forth? Okay, we'll get to stroke shortly. Everybody okay with that, right? Guys?
Yes, sir.
So,
All right. So anybody here know someone who is a cardiac patient?
Yes.
Right. Anybody else? So
Yeah.
all I'll tell you is if it is somebody who is close to you, right? Especially if it is somebody you live in the same home with, let's say it's it's a family member, I strongly advise you. Now this is you will not see this in a lot of programs, but again, I've been teaching for so long, and the years I worked in EMS, one of the issues we've observed, and you can ask whether it is Trinidad, whether it's any other Caribbean island, whether it's the US, Canada, the UK, if you ask an EMT or a paramedic who responds on an ambulance, they will tell you the same thing. A lot of times we have patients whose relatives are not aware of all the medications the patient is taking, who are not aware of all what the dosages are. So if you take, if now I hope you could remember everything we've covered in class tonight. But what I would like for you to do for me, not as your lecturer, not as a student of Costat's program, but simply as one person to another, for the benefit of our colleagues and relatives and so forth, what I would really like for you guys to do, if the person, your relatives at home, suffer with any of these conditions and they're on medication on a regular basis, let's say every day, the diabetic patient, the hypertensive patient, the cardiac patient, whatever it is, just get some, get paper, write down if you want to type it and print it, please. Information on the patient. Name, age, what medical conditions they suffer with, if they're allergic to anything. So the same sample there, but what we're doing is we're not looking at the signs and symptoms, we're looking at the conditions. What medical conditions they suffer with, if they've had any surgeries, what medication they're taking, the names of these medications and the dosages. I'm telling you, these things are extremely important when the ambulance gets there and we get into the hospital with the patient. To have this and to pass this off to the doctor who now has critical information. Because sometimes, what if the patient is already on a blood thinner and they're allergic to another blood thinner that the doctor may want to give? These are little things, right, that are very important. So please, if you guys can do that, I would say thank you very much. Okay? So think about it, and I'd really appreciate it if you guys could do that. All right. Let me see. Let's look at any questions? Are we okay? No, nobody has any questions? Okay, so while I'm preparing the next video, we're going to look at a stroke. What I'd like for you guys to do for me in the chat, just as you did last day, just type in your names, please. Okay?
The WhatsApp chat.
No, put it on the Zoom chat here. All right? Put it on this classroom chat here. So later when I'm reviewing, I could just get access to it and enter the attendance on the document that Costa will send me. All right, so I'm gonna share now the video on a stroke. Let's look at it. Just pay attention, please.
Every 2 seconds, someone somewhere in the world experiences a stroke, and 1 out of every 6 people will have one at some point in their lives. Strokes deprive brain cells of oxygen and are one of the most common causes of death and a leading cause of preventable disability. When someone experiences a stroke, quick medical care is critical and can often help avoid permanent brain damage. But what causes strokes in the first place, and what can doctors do to treat them? The brain makes up just 2% of your body's mass, but consumes more than 20% of the oxygen in your blood. That oxygen is carried to the brain through a system of arteries. Carotid arteries supply the front of the brain, and vertebral arteries supply the back. These are connected to each other and divide into smaller and smaller vessels that get billions of neurons the oxygen they need. If the blood flow is interrupted, oxygen delivery stops and brain cells die. There are two ways this can happen. Hemorrhagic strokes are when a perforated vessel allows blood to leak out. But the more common type is the ischemic stroke, when a clot blocks a vessel and brings blood flow to a halt. Where do these clots come from? On rare occasions, a sudden change in heart rhythm prevents the upper chambers of the heart from contracting normally. This slows down blood flow, allowing platelets, clotting factors, and fibrin to stick together. The clot can be carried up towards the arteries and blood vessels supplying the brain, until it gets to one it can't squeeze through. This is called an embolism, and it cuts off the oxygen supply to all the cells downstream. The brain doesn't have pain receptors, so you can't feel the blockage itself. But oxygen deprivation slows brain function and can have sudden, noticeable effects. For example, if the affected area is responsible for speech, an individual's words may be slurred. If the stroke affects a part of the brain that controls muscle movement, it can cause weakness, often just on one side of the body. When this happens, the body will immediately try to compensate by diverting blood flow to the affected area, but this isn't a perfect solution. Eventually, the oxygen-deprived cells will start to die, leading to brain damage that may be severe or permanent. That's why it's important to get medical care as fast as possible. The first line of treatment is an intravenous medication called tissue plasminogen activator, which can break up the blood clot and allow blood to flow again in the compromised artery. If it's delivered within a few hours, this medication greatly increases the chance of surviving the stroke and avoiding permanent consequences. If tissue plasminogen activator cannot be given because the patient is on certain medications, has history of major bleeding, or the clot is particularly large, doctors can perform a procedure called an endovascular thrombectomy. Using a fluorescent dye that illuminates the blood vessels under a strong X-ray, the physician inserts a long, thin, flexible tube called a catheter into an artery in the leg and maneuvers it all the way to the blockage. A retriever is passed through this catheter. It expands and anchors into the clot when it's just past it. The catheter then pulls the clot out when it's removed. These treatments need to be delivered as soon as possible to preserve brain function, which means figuring out fast if someone is having a stroke. So how can you tell? Here are 3 quick things to try. 1. Ask the person to smile. A crooked mouth or facial drooping can indicate muscle weakness. 2. Ask them to raise their arms. If one drifts downward, that arm weakness is also a sign of a stroke. 3. Ask them to repeat a simple word or phrase. If their speech sounds slurred or strange, it could mean that the language area of their brain is oxygen deprived. This is sometimes called the FAST test, and the T stands for time. If you see any of those signs, call emergency services right away. Lives may depend on it. We're on a nonprofit mission to revolutionize education. Click here to learn how you can get involved.
All right, guys. So everybody name on the chat, right? Good. What are the 2 types of strokes we have? That was listed there. You have 2 types of stroke we saw this speak about in the clip. Anybody?
Ischemic, I think
Right, so
that's
it's
how it's pronounced.
ischemic, right?
Yeah.
So we have ischemic stroke, right?
Hemorrhagic Thompson.
And hemorrhagic stroke. Good. Thank you. So with the ischemic stroke, just like with a heart attack where you have a blockage of a vessel supplying the heart, with the ischemic stroke, you have a blockage of a vessel in the brain. And the area that vessel supply no longer gets any blood. Apologies. Right. So the hemorrhagic stroke, there's a rupture of a vessel in the brain. And those both strokes are dangerous, but typically, I would appreciate it if I'm wrong, somebody tell me I'm wrong. But a lot of the times, based on previous classes that and lectures that I've attended to, I've heard doctors say that the ischemic strokes are usually the fatal ones, well, faster because it's a blockage and you need of a rupture, sorry, and you actually need to get that vessel sorted out and stuff, right? Again, this is what I've heard doctors say. Um, I do not have any data to back up that statement. What I could tell you though is for us in pre-hospital care, once we're outside of the hospital, we're looking at identifying that is actually a stroke. Whether it's a hemorrhagic stroke or an ischemic stroke, we use the FAST technique there, facial droop, arm drift, slurred speech, and of course time to identify and give us the biggest indicator that yes, this person may be suffering a stroke. We need to get them to medical attention. Call for help. Okay. So let me just pull back PowerPoint here. Right. And right, see what's the recommendation. Good. So we're going back now to a stroke. So it's either the blood vessel burst or it's blocked. And remember, the demand for oxygen is so great, right? So once you have a drop or a stop in the supply of oxygen, the brain gets affected. Okay. Fast technique, facial droop, arm drift or arm weakness, slurred speech or speech difficulty, time to get help. Oh, sorry. Fast assessment tool gives us a quick indicator of the possibility of someone having a stroke. Okay. Monitor the person. Responsiveness and breathing is your number one thing here. One of the things I want to tell you is, um, and this is based on my experience and quite a number of colleagues as well. Typically in the Caribbean, a lot of people tend to, well, a lot of the older folks tend to look at household remedies. And I am not disputing the possibility of medicinal benefits of using nutmeg. Okay, I've heard a lot of people talk about using a nutmeg or using nutmeg for certain medical benefits. However, in a situation where you suspect somebody's having a stroke and you put an entire nutmeg in the person's mouth, what do you think can happen? All right, I'll stop the share. And I'll leave that up open for the class to give me a response. Putting a whole nutmeg in somebody's mouth who is suffering a stroke, what do you think could happen?
Could slip at the back of the throat and they start choking.
Good. So you could slip to the back of the throat and they could start choking. Anybody else? Anybody agree? Anybody disagree? If you agree with Jamal's statement, just raise your hands, please. One, two, three, four. Right. Almost practically everywhere. Jamal, for a minute there, I thought you're going to be alone, but then the hand starting to go up. So, yeah, and that's correct. Thank you. And I'm telling you that because I went on a call and Khadija, you have a question or your hand still raised? Okay. Right. Yeah. So, yeah, and this is what I saw. And the elderly gentleman, more than likely suffering a stroke because he had complete paralysis of one side of the body. And I saw, like if you take your tongue and you poke it on the side of your on your cheek, the impression it gets, I saw that it gives. I saw that. And I asked, I said, to his wife, I said, Auntie, what is his mouth always like that? And she said, no, she put a nutmeg in his mouth because she heard that that will help him with a stroke. Again, I am not disputing that. But in the emergency setting here, I am more concerned with this causing an airway obstruction. And these are some of the things we'd want to be mindful of. Okay? So in terms of monetary responsiveness and breathing, you would want to look to see if there's any objects there. Sometimes patients with dentures, sometimes the dentures may come, for whatever reason, the patient fell, the dentures may come loose. It could cause airway obstruction. Do not give anything to eat, drink, or paralyze. And here's why: the throat can be the throat can be paralyzed. Do not give the person anything to eat or drink. Right? The throat can be paralyzed. Why? I got my speech confuffled there for a minute, right? The throat can be paralyzed, which restricts swallowing and causes choking. That's a no-no. Not even water to drink. Okay. Loosen tight clothing. Call for help. Put the person lying on the side. If they're unconscious, turn them on the side. Open the mouth. So if they start a drool, it comes out of the mouth. It doesn't obstruct the airway. And that's all you can do for a stroke patient outside of the hospital. Everything else needs to be done in hospital. Okay? Any questions on that? So I will post as over the coming days. It's just the cough has me really, really uncomfortable. But I will post everything onto the e-classroom. In addition to the recordings, I'll add the little videos as a separate attachment, so you guys can look at it if you wish. Um, and next class, there is some specific information that COSTAT has in their program outline that I would like to engage you guys with in terms of various categories, excuse me, such as the emergency medical responder, the emergency medical technician, and all those things, what their level of responsibility is. Okay, and this is the separation of the program, or the differentiation, sorry, of the program from other programs. Okay, so I think we covered a lot of information there. Next class, we're gonna cover things like fainting, seizures, diabetic emergencies, right? And then we'll touch a bit on some of the injuries, and that basically we're gonna I'll just look and see how many sessions we have in total and then identify when we're gonna close off the first aid, because I'd wanna see if it's possible to do a practical session. I know some of you guys may be in another location. I'll probably just post up some videos on it and see what's the options. But I'll have to speak to the dean's assistant about that for you guys. Okay. Let me just stop the recording here.